Hi, Jim. I will be your speech language pathologist today. These are my interns, Becca and Alyssa. They will be helping us today. How are you doing?
I am in a moment doing good, yeah.
Okay. My interns and I have reviewed your chart and case history. Today, we are going to work on some treatment approaches due to a diagnosis of Wernicke's aphasia. Becca is going to tell you a little more about our plan.
First thing we'll work on today is making your speech more understandable by using a treatment called Expanding Expression Tool, or EET. Do you have some specific interest that we could implement in this therapy technique?
Mid fruits, watch sports.
What are your favorite sports to watch?
Flabber yeah, I'm watching football.
What's the purpose of this treatment and how will it help Jim?
Jim suffers from Wernicke's aphasia, which is a language disorder that makes it difficult to understand and communicate. A tool to help avoid frustration would be beneficial for your husband, so we will be implementing EET, which aids in expressive language and reduces frustration in word-finding tasks. EET has 7 categories, including green group, blue do, what does it look like, what is it made of, pink parts, white where, and what else do you know? Does that make sense?
Yeah, it does. Thank you.
Okay, Jim, let's use the word football to describe and categorize today. First, I'm going to show you a picture of a football. Please tell me what group this object belongs to.
Storts.
Yes, that's correct. A football belongs to the sports category. Next, what do we do with a football?
Throw doll.
We can throw the ball, catch the ball, and score with the football. Next, what does the football look like?
Football is small, Benderstog brown like this.
Yes, a football looks brown and small, and it has a white stripe on it, which are the laces. What is a football made of?
Football make bastic.
You're not making sense, Jim. You know what a football is made of. It's made of leather.
I know it's hard to not speak up for him when he's struggling, Helen, but we are trying to see what he can do on his own. So please make sure to let him answer as best as he can.
A football is made of brown leather. Jim, you're working really hard. Keep up the hard work. Next, what are the parts of a football?
Is ball.
You're right, it is a ball. The parts of a football are the ball and the laces. Where would you find the ball?
Tome in back row garage.
Yes, we would find a football at home or in the football field. Lastly, do you know anything else about a football?
Go ending up in touchdown, yay! I watching on television long. Quarterback, mine old Joe Montana. Yes, Chiefs like.
Yes, you watch football on television. Thank you, Jim, for working on this treatment approach of EET with me.
That seemed to go well. Is this something I could use at home when he's struggling to find words that he wants to say?
Of course, that's a great idea and will help with generalization. That will be great for both of you.
End of scene 1. Scene 2.
Okay, the next thing we'll work on is reading comprehension. For this, we will be implementing a treatment approach called oral reading for language in aphasia, also known as ORLA. For this activity, we will be practicing reading sentences out loud. I'm going to have Alyssa administer this treatment approach.
Okay, Jim, our first sentence, the horse jumped the fence. Now point to the words with me and listen. The horse jumped the fence. Okay, now we're going to point to the words and read them together. The horse jumped the fence. Perfect. You're working so hard. Now I'm going to say a word in our sentence, and I want you to point to it. Are you ready, Jim?
Tess.
horse. Whoops, I said horse. A horse is an animal. It starts with the H sound. Let's try it one more time. Better, you got it that time. Now tell me a word and I will point to it so you can tell me if it was right.
Word is tense.
I heard tense. Did you mean fence?
Fence.
Good work, Jim. Now we are going to point to the words and say our sentence again. Are you ready? The horse
Horse
jumped
the
the fence.
fence.
All right, Jim, that is the end of treatment approach for Orla. Thank you for all your hard work. Do you have any questions?
No.
End of scene 2. Scene 3. I appreciate your time and effort you put in these last few weeks to try and get Jim back to his somewhat normal self. Do you think we are close to being able to end therapy?
The main focus of our treatment has been returning Jim to his activities of daily living. Due to Jim's difficulty with reading comprehension, continued difficulty with naming, and level of understandable content in his speech, we do not feel that it is appropriate to discharge him from therapy. Time to discharge depends greatly on many factors. As Jim continues to progress and meet his goals, we will be closer to discharge. Do you have any other questions?
I think we're good. Thank you so much for everything.
Of course. See you both next time.
See ya.